A message to Congress from NFIB. The healthcare reform bill in the U.S. Senate will ignite drastic changes stretching over 10 years. 6 congressional elections will come and go before the story is complete. 2010, election year. Congress narrowly passes the Senate bill, and at the White House, cameras flash, cheers erupt, the president lays down his pen. The crowd disperses. Now, America and its lawmakers will wait 4 long years before the reforms begin to unfold. But with little notice, a swarm of new taxes begins immediately. Employees, consumers, and patients will bear the burden. First, a new tax on innovative pharmaceutical manufacturers. Then, massive cuts in doctors' Medicare income. 2011, a big tax falls on insurance plans that small business and individuals buy, but only a small tax on plans that big business and government buy. It rises in 2012, 13, 14, and 17. A new tax on medical device manufacturers, new limits on FSAs, higher taxes on HSA distributions. People can no longer use HSAs, HRAs, and FSAs for over-the-counter medicine, except insulin. New reporting requirements for business, new taxes on retirees' drug coverage. 2012, presidential election year, new red tape for business, but still no healthcare reform. 2013, another new tax on insurance. It aims for the rich, but slams the middle class. It's not indexed to medical inflation, so just like the AMT, it lowers the boom on more people each year. Consumers will have fewer opportunities to deduct medical expenses from income taxes. A new Medicare payroll tax kicks in. It's not indexed to inflation, so it grows each year. For the first time, Medicare taxes are siphoned away for other purposes. 2014, another election. Reforms finally begin. New health insurance exchanges open. Are the incentives well designed, or will shaky risk pools send premiums soaring? Now, every American must buy health insurance or pay fines for not buying it. The fines increase in 2015 and 2017. Many employers must provide insurance or pay additional taxes if they don't. How many employers will be forced out of business? How many jobs lost? The Senate bill moves tens of millions of people into Medicaid. Will bursting state budgets lead to soaring taxes? Temporary tax credits help some small businesses purchase insurance. Are the credits big enough to matter? The bill makes it especially expensive to hire workers from poorer households. How is that fair or wise? 2015, 2016, another presidential election. 2017, 2018, another election. New reforms kick in year after year, administered by scores of new bureaus and agencies. 2019, the final reforms fall into place. What did consumers, patients, and voters get for 10 long years of waiting? Not universal coverage. Back in 2009, the Congressional Budget Office warned that the bill would leave tens of millions without health insurance. Not lower costs. In 2009, the Centers for Medicare and Medicaid Services warned the bill would increase costs. Not a smaller federal deficit. Reality has a way of crushing budgetary gimmicks. 2020, presidential election year. The first elections when voters can view these massive changes in retrospect. They vaguely recall the thrill and cheers of a White House ceremony many years earlier. Will voters look back and see a job well done? Or will they see a landscape littered with crushing taxes, failed reforms, millions still uninsured, soaring costs, exploding debts, shuttered firms, and lost jobs? In 2020, how will they feel with the benefit of 2020 hindsight?